how we can solve a job on atrophy cases with a graftless solution. Moreover, that is just not a solving case, but how we can improve the quality of life of the patient, because that's what patient comes for. We have assessed more than 208 patients between 2017 to 2022. Okay, and who have undergone full mouth cases, and those who were kind of atrophied cases, and kind of or maybe a resorb bone cases, something like this. Okay, all majority of they are periodontally compromised. We also included medically compromised patients like diabetes, controlled diabetes, high blood pressure, everything, completely edentulous cases. So there was nothing like, other than absolute contraindication, we included all type of cases in our studies. Okay, and all the cases were done with the immediate loading. I'll share you one case where you can see his oral health related quality of life. He was having compromised chewing, of course, poor smile, low confidence, his speech was affected, social interaction was hampered, professional life was hampered. Okay, see the bone, see the amount of bone. There's a high amount of atrophy is there. In anterior, I think only say around 7 millimeters, 8 millimeters width is there, but height is only 6, 7, 8 millimeters vertically. Okay, so this is a technically very difficult case to do with the bone grafting and all this stuff. But however, we did this case with a cortical TPR implants, zygomatic implants, and also with the pterygoid implants. Okay, and in the lower jaw, you can see on the right hand side, we did something called nerve bypass. And on the left hand side in the lower, we engaged the lingual cortical engagement, and we did the immediate loading of this particular case with a good amount of follow-up. And this is the patient's before and after, and this is the smile of the patient's day 1 versus day 5. So there has been a tremendous improvement in his quality of life after the treatment. And what we could find that he was able to chew well, he was able to interact well with all his colleagues, his social circle was quite glorified, and he was very happy. And in fact, we have referred us 2-3 more patients again. He was from UK, basically he fly down from UK for this particular transformation. Okay, so that's practically possible. The processes which we gave was a lightweight process, so that all soft loading will be happening on the implants, and we will not worry about excessive loading on the implants. Okay, now coming to this particular case, see this girl, what she has done. She has not done anything wrong in her life. She's suffering from this kind of problems, severely periodontally compromised dentition. Okay, her life is compromised. Her college, she cannot interact with the patients, interact with her friends, sorry. In her confidence is pretty low, speech is affected, everything is compromised. Okay, see her bone again. You can see absolutely compromised bone is there in maxilla and mandible, everywhere. Okay, so here we decided to give any chance. Our intention was to give screw retain process to the patient. So any chance, if in future patient any kind of maintenance, we can retrieve that process and give patient a fixed teeth. Okay, so with help of zygoma and pterygoids and nasal implants engagement and all this stuff, we restored our case, and this is what we got the follow-up of the patient. Although we treated this case into 2020 one, I think so, yes, 2021. Now this is more than 3 years, but we have a 1 year follow-up of this patient. This patient came for a follow-up 1 year after, and this is a day 5 of the patient. You can see, compared to day 1, patient is chewing. Because she got a beautiful teeth, she is chewing now. She is able to chew properly, and because chewing, she could smile well. Can you see the amount of confidence which she has gained? Look at her smile. She's looking absolutely wonderful. So she got a wonderful smile. She's very happy, and I'm almost, you can see
What is love
in
exactly?
this particular thing.
It's putting someone's needs before yours.
Smile.
Wow.
It's just not a smile. It's a tears of happiness.
This was my
It's
view
easy to
today.
make someone smile. We are
How was
dentists, we can do
yours?
that, but it's very difficult to get someone. That tears of happiness which you can see, because this is something where you can make real changes in quality of life. So this is that kind of a work we should do, and we can easily, improve such quality of life of patients with certainly such technique.